Yeah. Well, OSHA's coming tomorrow. I'm not sure if they have statutory authority over the public, which is one of the other kind of frustrations that we might have with any irritation we have with some other agencies that we think aren't doing their job. Sometimes it's a statutory authority limitation issue.
Okay, I do say we have Andrew Levinson coming tomorrow.
Yes. Yeah. Well, let me ask you this, since maybe what we can try to hybridize what some of the Q&As are and some of the COVID questions. It seemed like a number of people talked about that let's start, we'll do the non-traditional worker part, and then we'll go to John, just because that's kind of how we set this up this morning. Bob, what do you think, what kind of additional, pathways should we be using to educate employers in these non-traditional user settings that obviously reared their ugly head, especially in COVID, for example? I'm thinking of like long-term care and that sort of thing, where those nursing assistants and home care workers do not typically wear respiratory protection. And unfortunately, they were some of the first to be harmed. And so if we heard from several people that the employers don't even either know about or think it's their job to have figured this out or to have included this as part of a comprehensive safety and health program, if they have one. What do you think? I mean, is that a NIOSH obligation, do you think? Or is that part of the research agenda, or hazard recognition, that sort of thing? Is that part of this, or is that too far afield?
No, I would start by engaging with employers and frontline workers to understand their perceptions, their needs, hear their recommendations, whether this is called research to practice or, applied research. I think that's an absolute, not authority, but it falls absolutely within the purview of NIOSH in partnership with academic researchers, frontline groups, worker education, partnerships with unions, worker centers, community-based organizations, particularly for workers who are not in formal employment relationships. So I think that's probably where I would start in terms of moving ahead and engaging with these groups and really understanding what's needed on the ground.
Melissa, could I chime in?
Please do. And I was going to also say other colleagues on the speakers panel can also, because we have a good amount of time, I think. Go ahead, John.
I've been thinking about this lately with regard to the importance of NIOSH with regard to COVID protection of workers. And I think the fact that we have less representation by unions in the labor force in the U.S. has in part led to a devaluation of occupational health and safety in general. And this is the respiratory protection piece that we're talking about now is just one piece of this relative devaluation of the importance of occupational safety and health. And I think it would be good, I don't know how to make it happen, if NIOSH had greater visibility, period. NIOSH is proving its value now, but I frankly think most employers haven't even heard of NIOSH other than with regard to N95. So that I think we have to make occupational health and safety as important as it actually is with regard to public health.
Okay, thanks. Anybody else on the panel want to try to handle that one question we were talking about? Is it part of NIOSH's research agenda? What do we do about these non-traditional user employers who we probably do have a respiratory hazard that they need to help prevent against?
Melissa?
Yes, go ahead, Dan.
I think it is important to realize that NIOSH is not a regulatory agency. NIOSH can set standards for respiratory protection, for example, and they can approve respirators, but it is up to other agencies to make the determination that you shall use a NIOSH-approved respirator in this situation, and to that you shall do hazard assessment, and that you shall do fit testing and training and medical evaluation and that sort of thing. There are limitations to the scope of NIOSH and its ability because it's not a regulatory agency. Could that change? Should that change? I think that's a valid question, and one that I think this workshop is getting to. Right now, there is no overall overarching health and safety executive in the United States that has regulatory authority. You've got OSHA for the workplace, but even OSHA's scope is limited to certain workplaces. You've got other agencies that regulate their specific workplaces. But there is no overall health and safety executive whose authority could be then extended to the public for the multiple uses of face masks.
Well, right now we're talking about employers, and I, obviously understand what your point is about regulation, but I think what we see here is an example of where, if we're talking about respiratory protection moving into segments of employment that have not been historically thought about as being in a respiratory protection program, some aspect of this is the obligation of the employer to recognize the hazard. And in recent memory, that didn't happen in a couple of very high risk occupations. And I'm just saying that if this need to address these underserved, not traditionally thought of worker groups that might need respiratory protection, there is a role for, and it seems like there would be part of a research agenda to examine both employer and employee hazard recognition, but it's awkward. And
I think a good bit of that research has been done. The question is research to practice. How do you take that research and apply it? What sort of regulatory structure do you have? And I'm just not sure that there is such a regulatory structure in the U.S. And I think this workshop is asking that question.
I think this is pre-regulatory. At least that's where I am innocently going here. Anybody else got a comment on this? I don't want it to be just two people talking.
Melissa, Jim Johnson, I think one of the things that strikes me is the significance of the last line of protection in this COVID issue, and the fact that the bottom has now become the top for protecting our critical healthcare workers, and the ability for the system to step back and rethink the priorities and the perspectives that were given this last choice, now that it has become very critical, and how we proceed with looking at PPE now as a more recognized component of protection, other than the fire service that accepted it because they had the unknown environment. But if you look at the pandemic and say, are we really now thinking properly about PPE, we need to rethink about how we value it and how we put our research into it, how we train for it, and how it fits in to the priorities of protecting workers.
I agree with you, Jim. And, the Institute of Medicine, the National Academy of Medicine has been stating, and lots of people have been stating for years now, that you need to build up supplies, you need to do behavioral studies on how people use respirators and PPE, and all of that was, for the most part, ignored by the executive branch, anyways, over the years, for gearing up to what ultimately became the worst nightmare. I'm not sure everyone thought about a pandemic being as bad as this one is in terms of transmissibility. But this has been talked about for a long period of time, and certainly NIOSH has been funding studies on this, and yet we find ourselves as though we had never thought about this. And to some extent, that's true of the rest of the world, other than there's a few countries that seem to have stockpiled PPE and done that. But I don't know. I don't want to say this will be a lesson learned, but certainly the warnings have been out there on the importance of PPE in a pandemic, and it wasn't taken seriously that I can see.
All right, we've got, I want to sort of still get to the other half of the population that we were supposed to be thinking about, and that is the public. So, John, do you have some burning issue you think we should bring up here, sifting through your summary?
Well, I would say that an important point that was made is that we should not let the perfect be the enemy of the good. Right. We're not going to be able to reproduce the rigor of an OSHA respiratory protection program in terms of protecting the public. So we have to, I think, design programs to address legitimate concerns about respiratory protection of the public without expecting that we're going to be able to do fit testing on everyone. And the education of the public has to be a bit different than the education of employers and represented workers. So I guess I would start with that. And I would also say that I think the myth that respirators, I'm kind of specifically thinking of N95s, are hazardous to the health of most wearers. I think that's a myth that needs to be busted. We'll need more research perhaps to bust the myth, but the research that's available suggests that unless you're really impaired in terms of the pre-existing heart or lung disease, or you have legitimate psychological problems with, having your face covered, most people can wear, including kids, can probably wear respiratory protection without undue physiologic harm.
Mm-hmm. Good point. The whole panel, anybody else want to weigh in on public users?
Well, I've seen the YouTube things on carbon dioxide and whatnot. Mark Nickus addressed that a little bit. The real issue right now is that respirators are not available to the public. They're not even available. I mean, they're barely available, and to the frontline workers. So I don't think we have any myths to bust for respirators right now when it comes to COVID for the public. But what we need to do is, I do think we need to think about, NIOSH has been, a NIOSH approved respirator to me has been sort of the gold standard. It's been the only standard according to OSHA, but it's really been a gold standard. It's been wonderful tests and procedures and rigor into that system. And so one of the questions, we've heard about this, one of the questions becomes, when you don't have the respirator program that you won't have for the public, you may or may not have it for non-traditional workers, you're not going to have the kind of respirator program that the certification program for NIOSH was designed for. Are there alternative types of respirators that make sense somewhere down the road? Now it doesn't matter because there are no respirators available for the public for this. But down the road, are there types of respirators that fit that? And I keep thinking about the fact that, can people design really good large sealing surfaces on filtering face pieces so that fit testing isn't required? So in other words, can you figure out how you now design the respirator for what the public could actually use? I think the respirators that are out there are probably not appropriate in general for the public. So how do you, if you're really interested in respirators for the public, how do you think about future designs that would meet the requirements of what that program could be and instruction.
Thanks, Howard. And Melissa,
Yes.
Stephanie Holm has a pretty illustrative slide that she'd like to share at this point.
I was just going to go to her. Go ahead, Steph.
Hey, I've got the slide up whenever the tech folks want to show it. But bouncing off something that was just said, I also wanted to add that certainly when testing has been done previously, there are some specific N95 products that the 95th percentile was a 90% reduction, even without fit testing. So, I mean, I think at that point, we know that it's possible for there to be products that can have really impressive reductions without fit testing. This is just a figure that I pulled together a while ago to sort of make the point about, the perfect not being the enemy of the good. And I've used this multiple times talking about wildfire smoke exposures that, often in the Bay Area, when we've had bad wildfire smoke exposures, we've had days where the outdoor AQI gets into the hazardous or very healthy or unhealthy range. And certainly, as someone just said, the gold standard is a, fit tested, NIOSH approved N95 respirator, and that's going to decrease folks' particle exposure the most. But I feel like this is a nice illustration, even though, again, it doesn't have any sense of the variability, right? There's sort of error bars that you can imagine on each of these dots. But the idea that, a non-fit tested N95 that's going to reduce your exposure 75 or 80% might still be able to drop you multiple sort of, experienced AQI categories. And so that can really make a big difference for the general public. And then a surgical mask as well may be able to drop, the equivalent of sort of one category. Even though it's a relatively small reduction, that may be enough to make a difference for someone that's sensitive.
John, this is Bob. One of our listeners, not to be publicly identified, has brought up the very good point that recommendations for public use of respiratory protection generally rest with local and state governments. I think that's certainly been true by and large in California prior to the standard for respirator use for wildfire smoke, which was passed by a regulatory agency. But generally speaking, during wildfires, the guidance documents have been issued in conjunction with local county health departments, by and large, put out, and they have varied widely. Which raises, I think, the question for me that this panel should address, I think explicitly, in my view, is whether or not NIOSH, as the leading public health agency, should expand its mission and responsibility to cover the public users of PPE. Trying to think back to the initial enabling legislation of NIOSH, which is for worker protection. But I think in this case, I think it has really a logical responsibility, and I don't know what Marianne, whether she's cringing at my recommendation, but I think if not NIOSH, then who?
Well, I'm sure there'd be agencies that would be happy to step into that. They just wouldn't be competent to do it. John, were you going to say something?
Yeah, I was just going to say that I totally agree that in California, at any rate, the public is bombarded by different messages when it comes to wildfire smoke respiratory protection. And Stephanie and I are both involved with other folks to try to harmonize the messaging that county public health officers are giving versus the state health department. And we've involved NIOSH and EPA in that as well with regard to wildfire smoke. But, what you're saying, it's a larger issue than wildfire smoke. And I think Marianne probably tomorrow will probably touch on whether NIOSH is considering or willing to take a larger role with regard to respiratory protection and the public.